Hey, what's up, everybody? Jason Wisniewski from JW Senior Insurance coming back at you with another video today. And this is a video that is really unfortunate that I have to make, um, but it is really crucial that we combat fake news that floats out there because now I'm starting to get phone calls from some of my own clients, and I see other brokers are as well. And you're probably going to see more videos like this one coming out just to reassure people. But I will guarantee you right now, rest assured, it is 100% fake news that President Trump has ended Medicare Part D. This is just complete nonsense put out by left-wing influencers and certain news stations that are trying to score cheap political points because we have a midterm election coming up in November. Um, no matter what your political leanings are, whether you agree with the Democrats or the Republicans, really doesn't matter much in this instance. It's wrong to put out misinformation and scare senior citizens and disabled people to score cheap political points. It's disgusting, and it needs to stop. And so that's why I'm making this video today, to let you know what is actually happening, the background to this story, how it started, who will be affected and who will not be affected. So the headline is the more accurate headline is a Medicare Part D temporary subsidy from 2 years ago is ending. That's really about it. So, to put this in actual context, we're talking about a $10 per member per month subsidy that only affects people that have standalone prescription drug plans. It doesn't even affect anyone that has a Medicare Advantage plan, that's on a dual special needs plan, that gets low income assistance from Social Security to help pay for prescriptions. Nobody on Medicaid or a state pharmaceutical assistance program is affected. I'll remind you that over 54%, more than half of people that are on Medicare are on Medicare Advantage, and this doesn't affect them at all. 0%. So, to put this, to give you some background on how we got here, a couple years back, the Biden administration, back in 2022, passed the Inflation Reduction Act. And what the Inflation Reduction Act did was, on the positive side, put a cap, an out of pocket max on prescription drugs, but on the negative side, it put the responsibility, it basically let drug manufacturers off the hook and put a lot of pressure on the insurance companies to pay claims that they hadn't been used to paying. Now, I came into this business in 2006, and prescription drug plans were in a much different structure. Back then, you had 50 different standalone prescription drug plans to choose from. By the time the Biden administration passed this law, it went from 11 all the way down to 5 by 2024 because there was no profit margin for them. Their razor thin margins were being squeezed even tighter. So many companies were getting out of the market altogether, and the five companies um, that were left were basically in a position where they had to raise their premiums by insane amounts just to be just to break even, to be able to continue to offer these plans. So the Biden administration passed a temporary subsidy. that only lasted for 2 years, and it's $10 per member per month. We're not talking about a huge impact here. Also, at the same time, he was cutting back. He cut uh, about 5% of prior year's funding to Medicare Advantage, and that's Medicare Advantage and Medicare supplement plans. That's basically what makes revenue for the insurance companies. They already operate at relatively slim profit margins when you compare them to drug manufacturers, and drug manufacturers were big donors to the Biden administration. So it's not surprising how the Inflation Reduction Act was structured. But since the Inflation Reduction Act is passed, we have less prescription drug plans available for people that are on original Medicare with a supplement. They have less to choose from. We have non-commissionable Medicare Advantage plans for the first time in 2024 as a result of the Inflation Reduction Act. Many standalone Part D plans won't even work with an agent or broker anymore. We get paid no commissions for those. So it's going to be increasingly more difficult to find help if you're looking to shop for a standalone prescription drug plan. So this whole thing about ending the subsidy, the reason that the Trump administration is able to end this subsidy is because they've spent the past 2 years negotiating drug prices down, getting the drug manufacturers to offer these high cost drugs for cheaper, getting favored nation status. That's going to take some of the pressure off of the insurance companies. The Trump administration also restored funding to Medicare Advantage his first year in after he got reelected in 2024. Went from 3% to 5% increase that was badly needed after the effects of the Inflation Reduction Act. And that's starting to stabilize things a little bit, but this market is going to take probably a couple years to recover from the damage that was done by the Inflation Reduction Act. So, no, Medicare Part D is not ending. No part of Medicare was cut or is ending. Just a temporary subsidy, $10 per member per month, will probably be largely offset by the reduction in prescription drug costs. You already see the Trump administration roll out the GLP-1 bridge program for drugs like Ozempic and Wegovy. So this whole thing is just basically a way to score points before a midterm election. Now, some people who may support the opposition party may be upset by what I'm saying, but my job is not to cater to people's political leanings or feelings. This is much bigger when you're talking about people's health care and people's insurance coverage. It's important to know the correct information. And I mean, it's just ridiculous that I've had to answer calls that are concerned that the Medicare prescription program has ended. But that's what propaganda does, and it's dangerous. Um, but I'm just here to help to set the record straight. The majority of my clients have Medicare Advantage, so this doesn't affect you guys at all whatsoever. This has absolutely zero effect on your benefits going forward. So just wanted to put that out there, and um, we'll have more videos coming up about the annual enrollment period for 2027 plans. But I really hope that people just tone down the rhetoric. If you're trying to win an election, run on facts and not misinformation and outright lies and misleading nonsense. So that's all I have to say about this today. It's a shame that I have to put this out there. I really don't like to talk politics when I'm dealing with clients. I have clients that are Democrats, I have clients that are Republicans, and everywhere in between. It really shouldn't be about politics when we're talking about comparing health insurance plans, but here we are. So we will see you guys on the next one. Take care for now. You can also visit us on the web for updates, www.jwseniorinsurance.com. See you next time.